Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue this month's theme of fluid. Today's case is a 12-year-old male-neutered Bichon Frise who has had dyschezia and vomiting. He is very painful with abdominal palpation. So today, we're going to focus our attention on the abdomen. The first thing we observe is that there is a mass effect arising from the retroperitoneal space. This results in both ventral displacement of the descending colon and small intestine. On the ventrodorsal view, we observe that the colon is slightly displaced towards the right, noting that this is a mobile organ. Typically, retroperitoneal fat allows us to identify the boundaries of the renal silhouettes. In this case, those margins are obscured by the presence of additional soft tissue in this area. On the ventrodorsal view, we observe that there is soft tissue stranding in the retroperitoneal space. This often represents thin lines of fluid settled over adipose or fat tissue. We also observe that there are several small mineral foci in the region of the renal, pelvis, and diverticula. In the peritoneal space, we observe that a mild amount of serosal contrast is reduced near the apex of the urinary bladder. Two mineral opaque foci, or calculi, are superimposed with the urinary bladder on both views. They are noted on orthogonal views, and therefore we can make the assumption that they are within the urinary bladder. Our conclusions for this patient is severe retroperitoneal effusion with mass effect. This means we have to consider the possibility of a mass, and potential tissues of origin can include the left kidney, again due to both ventral and possibly rightward deviation of the descending colon, the adrenal gland, the retroperitoneal space proper, or regional lymph nodes. More specific differentials can be explored for each. If we consider masses of the left kidney, we could consider acute pyelonephritis with rupture of the ureter, transitional cell carcinoma with hemorrhage or rupture of the urinary tract, or renal cell carcinoma with hemorrhage. Masses of the adrenal gland or extra-adrenal tissue can include adenocarcinoma or pheochromocytoma, both with hemorrhage. Or retroperitoneal masses can also include hemangiosarcoma. Peritoneal effusion is considered mild and focal around the urinary bladder. There's also cystic calculi. Radiographs have started the diagnostic journey for this patient. However, more information is required. From an imaging perspective, next steps can include abdominal ultrasound, intravenous excretory urogram, or abdominal CT with a protocol adapted to an excretory urogram. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.